Hello, everybody. This is Teresa Schumard, and I am welcoming you today to our info session for the A.W.A.K.E curriculum for A.W.A.K.E coordinators. I am going to give you a little housekeeping before we begin. If you would like to ask a question, you can type it in the Q&A. Down in the bottom of your screen, you should see Q&A. If you would like to raise your hand, we will unmute you and you will be able to ask the question yourself. Now I'm going to pass this over to Kevin Bradley, who is our host for today, and thank you very much for attending.
Okay, thank you, Teresa. It's my pleasure as well to introduce Colleen Buzina. And Colleen is a clinical sleep educator at Methodist Hospital / Park Nicollet, where she's worked there for 36 years. She's worked as a sleep educator exclusively for 18 of those years. And prior to this, she worked as a night-day sleep technologist, pulmonary function technologist, and implemented the sleep store for Park Nicollet. Colleen has been dedicated to educating the community, schools, and civic groups about sleep and sleep disorders. Her West Metro A.W.A.K.E meetings began in October, way back in 1988, and she's been active ever since that time. So Colleen, thank you so much for agreeing to participate in this today. I think it's really beneficial to have somebody like yourself that's been doing this for so long, so you can share some of your wisdom about how you conduct the groups. So I'd like to start actually about just asking, how did you come to host these groups, and how did you actually get started?
Well, thanks, Kevin, and thanks, Teresa, for inviting me. I really appreciate the opportunity to share some information. I ended up doing all of this right from the get-go because I was forced into it by my manager, and it worked fine. I was helping out in sleep one day a week, and next thing you know, I'm doing A.W.A.K.E, and it was the most scariest thing I'd ever done because I've never spoken in front of people before. But I think the best message I received from my manager was, they know nothing about sleep, and you know everything about sleep. And so that gave me some of the incentive to step out of my A.W.A.K.E comfort zone and get out there and talk about sleep, which is a passion of mine. So it was easy once I got going.
Great, great. And I mean, we're pretty excited as well to roll out our new A.W.A.K.E curriculum for the coordinators. And hopefully this will give you the tools and stuff that you need to conduct your hosting your groups. But Colleen, what sort of obstacles did you have initially when you started this program, if any?
Oh, there's always obstacles. You have to get a buy-in from probably the people that you work with. You have to have helpers. It's very difficult to do this alone. I had a lot of help from my medical director saying that, yes, we want this to happen. And so I had secretarial help for the mailings. And then I also had other sleep technologists that said that they would be willing to help out as well. And so I would have a secretary down checking people in, and I would have someone kind of running the housekeeping things of the actual meeting, and then myself would probably be the host and the speaker. If I had a speaker come in, then I would be the host for that. And then that's what we ended up doing. It was a challenge to find space that was reasonable. We started out in our hospital auditorium, which worked really well, but that only held 100 people. And so I needed to find an alternate site, and ended up at a community center, which our department does pay for, which is nonprofit code. So we get it for about $250 for 3 hours, which is reasonable, I'm told. But you have a lot of hurdles to come about. You have to have good contacts with some of your vendors. If you're going to be having 1, 2, or more vendors, I usually have every vendor that I know attend just because my group is large, but I did start out slow, and you have to have a good rapport with them, and they're usually more than willing to attend and help out in a situation like that, because it's good PR for them, but just to have that good association with them. And I always counsel all of the vendors and speakers that we're running underneath the A.W.A.K.E guidelines. There is no buying or selling or soliciting, and so we need to be conscious of that. And I always bring that up to my helpers that show up, from vendors all the way through other helping venues, whether it's be patients or staff members.
Sure. Wow. And I was going to ask you actually how many people attend the group, but that's marvelous that it's over 100. Yeah.
Usually, yes. I usually have over 100 total. For a while, I was having up to 300, and I had to split the group, so I'd have a 4 o'clock session and an 8 o'clock session. But then I had feedback from my group that maybe we shouldn't do that because it was getting, in Minnesota, very dark, and people didn't want to drive at night. And so we just started going back to a 1 session. Sure. And it has been working well. The speaker comes on at about 6 o'clock.
Wow, that's great. And so where do you get the referrals from? Is it from your actual sleep center, or is there some publicity put out there about the group as well?
There's no publicity. I actually don't put it on any platform of any type. We actually had come up with a system. Every single CPAP prescription that was generated from all of our physicians, we have 10 physicians and 6 nurse practitioners and 3 sleep educators. So every single prescription that was generated, they stay on an A.W.A.K.E list for over 2 years. If they attend an A.W.A.K.E meeting, then they will stay on the list. If they do not attend an A.W.A.K.E meeting, they're dropped from the list after 2 years, so that we're capturing that newer group. But those that want to stay on and can't attend, like snowbirds, they will call and give us their information, and then we put them back on the list. And it has worked very effectively for maintaining a list. The problem, it's a good problem to have, is that our mailing list is well over 5,000.
Oh, wow.
You can't do a standard postcard because you're showing it's from a hospital and there's Hipaa violation. So it has to be in a first class envelope in a generic format, is what I've been told. And so it gets to be expensive in a first class envelope, but so we do them 3 times per year for this mailing instead of 4, which was my negotiating of the A.W.A.K.E. And that's how we end up capturing them, if you want to say, to put them on the list. And so my secretary helps with that process. And I've shared that a lot with a lot of other people that are thinking of starting an A.W.A.K.E, because it is difficult to know how to do that. If you're in a standalone sleep facility and you're putting prescriptions for multiple physicians from different areas, because your referral source is different, you have to get they're okay to do that to their patient population, obviously. But my patient population is all within Park Nicollet, so it's not an issue. But we offer, obviously, anybody that wants to join the group, because they can go on the website and request it and call me, and I put them on the list. And they stay on the list, and it works well.
Great. Wow. I didn't realize you were dealing with such large numbers. And just
Yes.
incidentally as well, who does fund that? Does it come from the sleep centers or the hospital?
It comes from the sleep center. They actually pay for the mailing and the paper and all of that. We used to have all of the vendors rotate the beverages and food, but that, of course, went on the wayside when we weren't allowed to accept any gifts. And so the way we handle that is that the sleep lab itself does the beverages for the night, and then our CPAP store, our own durable medical company, does do all of the food and cookies or fruit or whatever we end up having that night.
Great. Wow. So it's a big event. And do you run these how many times per year?
We run 2 full A.W.A.K.E meetings at the community center in September and December. And then in the spring, we have what we call a sleep fair, but we call it a sleep fair, and it's under the auspice of A.W.A.K.E because we allow all of our staff members within the hospital to attend. So, you know, there's a lot of places within the hospital that don't know that sleep disorders exist, or even that we have a lab. And so it's a good way to let your physicians know, other staff members that are on CPAP or anything like that, that you're available for help within the hospital and outside the hospital.
Wow, so it's not just for patients alone, there's healthcare workers there as well?
Correct, yeah. So we usually hold it for a whole day for the sleep fair, so pretty much from about 10 o'clock to 4 o'clock, and that way you hit the day shift and you hit evening shift coming on and those going home off a day shift. So that's the whole point of holding it for such a long period of time. And we typically will have, probably 300+ staff members that will walk through that area. And we have old sleep display, like old CPAP displays. We have all of the vendors there out in the lobby area. So, you know, they have to walk past this area regardless for getting food or going to the gift shop or whatever, wherever they're going. And so it's good PR for the place itself. And then we have breakout sessions during the sleep fair, like on care and cleaning, or ask the nurse practitioner, ask the sleep doctor. So if they can make an early one at 10 o'clock, they can do that, or they can do an evening one or a late afternoon one. And it's for patients and staff or whomever can attend.
Wow, that's great. It's a real interdisciplinary day for people, so I'm sure the information is great.
Yes.
And what about, do you find too there's people that come to these, the fair that, you know, are maybe struggling with the fact that they are querying whether they have sleep apnea, do they have a sleep disorder or not? Where do we put people like that actually don't have a prescription and haven't had a study yet?
So we give them information on sleep disorders, kind of a generic type of thing, pamphlet, and we give them information on how to schedule a sleep study and where to call and talk to them about that. And we also will give them information on like either a stop bang to see if they have sleep apnea, the questionnaire, or we'll do an Epworth sleepiness scale and to see if they're sleepy, and then say, here's your information, and we recommend that you schedule an appointment. And I would say a lot of people do.
Wow, that's great.
Yeah.
And some of the literature that you have out there, or pamphlets, or, you know, where does that come from? Is that something you've made yourself, or do you get it from some of the other sleep centers?
We do have one brochure on obstructive sleep apnea, but we actually use the American Academy of Sleep Medicine's brochure that they have. And we use them pretty exclusively within our department. And it has our phone number and our contact information on the back. Okay.
And I'm sure during the fair as well, there's some vendors there where people can actually see machines and masks and stuff like that, so it's not too foreign to them.
Correct. Absolutely. We have equipment hooked up. We have a lot of times we'll have a mock sleep study kind of scrolling on a screen, just different things like that. Anything surrounded by sleep. One interesting note, at the last sleep fair, we had, and I haven't obtained this from the AAA, but there was a set of goggles that you can put on and that demonstrates drowsy driving. And that was a huge hit because you put these goggles on and it makes you feel like you're really out of it, but that's what a drowsy driver would look like or feel like when they are going down the road. And that, you know, when you're sleepy, it's not your choice. And so you can nod off with your eyes open, your eyes closed type of thing. And so those type of things are, you know, little eye catcher type things. People want to interact, and that makes it a fun experience, and they kind of remember that. And even if they don't have, a memory of what's going on, as far as the actual pamphlet in their hand, they know it was at Methodist, they know where it was, and they can give us a call and get to us eventually.
Great. Wow. Sounds like a fun day.
Yeah.
So, you know, we're looking as well, like, do you actually promote, when we have our A.W.A.K.E group here, our Facebook group, it's nice because when people get together and share experiences and problems that they have in common, I mean, I always look at our Facebook page and see that, you know, there's peer-to-peer comments and advice.
Yes.
Which is great. Do you let people know that those resources are there for them too?
Absolutely. I did hand out information on the Sleeptember at the September A.W.A.K.E meeting just recently here at Park Nicollet. But in the past, I just look back on all my different presentations that I've done, and I have done 3 times what is A.W.A.K.E, or there was a couple other different catchy phrases that I had, sleep apnea and awake awareness. Just to get the word out that this is something that's available, and now that so many people have smartphones and things like that, they can access this information very readily, and it makes it a very good learning tool for them. And, you know, and then the, you know, CPAP assistance program, all of that can be tapped into. And so I'm probably in my A.W.A.K.E meeting in the spring, the sleep fair, I'll probably do a breakout session on what is A.W.A.K.E, and then really get some information out there for people, because I like to bring that information, you know, every couple of years to the people that attend on a regular basis or are new.
Great. And, you know, so in looking back, I know this is obviously really successful for you, but for people out there that are maybe considering starting a group in their area, can you just give us a couple of tips on how to run this successfully? I know you did say that you do need help, and it sounds like you do, for sure. But if there were some tips for people, what would you tell them to do if they were starting up a group?
First, I would get, again, some buy-in from the medical staff to help out. So maybe you could get 1 or 2 speakers lined up. So if you're going to do it quarterly or monthly or whatever, because when you have an A.W.A.K.E meeting, in order to get them back again, it's always good to have another date already set up and ready to go. Sure. So you tell them that the next A.W.A.K.E meeting is going to be March whatever, and then they put it on their calendar and they're going to be anticipating that date. So that's, I think you always kind of have to double up on your booking. The second thing is to make sure that, you know, AV requirements are there. Get some speakers that are very knowledgeable, and get in contact with all of your vendors, 1 or 2 or more, and lay the expectation out. And I think once you get a couple of meetings under your belt, it does run a little smoothly. And I know that if there's other A.W.A.K.E people in that area, such as here in Minnesota, I've gone out to a couple different places over the last 30 years of doing A.W.A.K.E and help them start one or their first or second meeting, just to kind of get things off the ground. And it's reassurance for the host, and it's reassurance for the patients as well. And it's a speaker that's already lined up. And I think that's very helpful to, you know, learn one, teach one type of thing. I think I'm a real big proponent of that.
Sure.
And then I always have a question and answer time. I mean, you have to have, my typical format is, you know, a welcome session. I talk about what's new in sleep medicine, like new papers that have come out, or like medical marijuana, that was the last one, or things like that. And then after that, I do a show and tell from the actual manufacturers. And the manufacturer will hold up their CPAP mask and say, this is the new latest and greatest, and this is why, and they'll explain about it. And they do a little 5 or 10 minute demo on it, and then they're done. Typically, I have found that if I have the DME vendors do that, it's kind of a no-no. That was a hard learning thing that I would caution people. If you don't want to play favorites. And so if you're going to be treading on someone else's proprietary download data or devices, you probably should just do it yourself, since the host is the person, and that is the best way to do that. And then after that, I usually will have the speaker come on, and they'll do their presentation, and then we have a quick question and answer of the presentation. And then after that, I open it up for all different type of questions. Anything related to sleep or sleep apnea or treatments or anything like that. And that is always helpful. Now, some people have already escaped out because the presentation is done, but those that stick around will usually benefit from some useful information. If I find out that there's not a lot of question and answers, I will usually start by bringing up the important things that I know of, that I hear all the time, like how often should I come back and see the doctor, or how often should I change my mask, or how can I change my durable medical company, or what about the Medicare, what do I do, it's been a while. Those type of things are common things, and that usually, will lead into a pretty good hefty discussion amongst the patients and myself.
Sure, and that's actually where I was going to go next was, hot topics. So, that's great that you highlighted that. Do you have actually any patient stories or patient panels that present as well in their experience?
I have had multiple people stand up in front and do a 10-minute little testimony. This is what has happened long ago, and this is what led me to diagnosis and treatment, and this is where I'm at now. And patients love that. They absolutely love that. And I've done that multiple times for different, different groups, depending on what the speaker is.
Great. And a couple of months ago, I think it was July, we, on our A.W.A.K.E Facebook group, we run a Facebook Live every month usually. Okay. And I think one of the ones that I enjoyed best, and most people did, was, hearing two stories from two patients and their journeys, which were quite different. So it's good to see, how people are struggling out there, or how people have, overcome obstacles with their mask or their adherence. And it just helps people understand that, they're not alone. So, yeah, I think when there's ever a patient panel people can relate to, and sure, it gives them some sort of hope and comfort for moving forward with their treatment. So again, we always encourage people, we're going to, funny enough, maybe look at another Facebook Live in November and maybe talk about medicinal marijuana and aids to help sleep, as well as maybe some weight loss programs that are out there and stuff that may help. So it's always a good idea. We love new members coming along all the time. And again, like I said, it's wonderful to go through and scroll and see peer-to-peer advice that people are helping each other out there in the communities. The other thing I wanted to talk about as well is, when you're running these and people, obviously are showing up and talking about their experience, can you actually just give an example of maybe some of the topics that people are struggling with right there, and how you maybe speak to that, or who you get to speak to these issues?
Well, depending on what the question is or what the problem is, if they're within the Park-Nicollet system, I take down their information and we'll call them the next day to address right away any issue that may be going on. And I think that obviously that's very helpful. If it's outside of Park-Nicollet, then I typically will give them some type of advice, like if they're saying that, their Medicare, something's not right, they haven't hit compliance, and I will advise them to get back to their home care company or to their doctor for assistance, and give them some tips while they're there. And if they show me what mask they have, because all the vendors are there, I'll give them some tips at that point. So those type of things typically are addressed really quickly within the Park-Nicollet system. If it's non-Park-Nicollet, obviously it takes a little longer, and I'm stepping out of the scope of practice within the bounds of the patient, so they need to follow up on them by themselves. But any patient within Park-Nicollet gets addressed right away. And if I need to go speak to that physician, like they're drowsy driving, and they weren't like that before, but now they are, and I'll say, well, let's get you in for a download, make sure your sleep apnea is under control and your mask isn't leaking, and if all is good and they're still tired, well, then obviously we need to get a hold of the doctor, and they're going to have to make a decision whether or not they're going to come in for usually another sleep study on CPAP, followed by multiple sleep latency test. And so, I help to expedite that type of thing. And so patients like that. I mean, that's good patient care, and that's good patient communication.
Wow, it's great continuity of care, actually. So well done. It's nice that you personally follow up with people as well with some issues, and then, direct them to the resources that are available out there for them.
Yeah.
I also like the idea that during the fair that there's demonstrations on how to clean the machine, because sometimes people have been asking that on the Facebook Live events, so it's important to maintain a clean machine. So, well, what sort of things are you telling them out there to do?
Well, we usually have a care and cleaning session that is done by our own DME, our sleep store. And, they talk about the daily cleaning of the mask and dumping the water out in the humidifier, and, cleaning it and not using Dawn soap, and just little tiny things that maybe they wouldn't think of, don't keep reusing your water, and cleaning your hose, and watching your filter. Sometimes you get patients that come in here and we take the machine out of the bag and it looks like there's a mouse living in their machine because the filter is so furry. And so, those are just simple things that we need to hear that multiple times to remember a lot of those details, and they're fine details. I mean, typically they're overwhelmed on just getting the equipment and learning something that they've never had to do before, and then implementing it into their every night use, let alone the next day having to do all the cleaning, to make it simple. Tell them, bring it with you into the shower. Just try to give them some tips that are going to be helpful for their situation. I mean, obviously if they're retired and they have all day to take everything apart, then so be it. But if they're a working individual trying to get 2 kids off on the school bus, then just tell them, bring it with you in the shower and just do it that way and hang it to drip dry. I mean, we just kind of bring it down to their level. And I think that makes them feel more comfortable instead of saying, oh, you have to do this.
Yeah, of course. Great advice. I love it. So again, the next slide that we have here is about the modules that we, during the summer, Teresa, Justine, and myself updated them, and just sort of made them a little bit more concise into 4 different modules.
Okay.
Do you actually use these, Colleen? Yeah?
Oh, these haven't been launched yet. This is something that, right, this is something that we just are going to be sending to the A.W.A.K.E coordinators. And so we're very excited. And as we go and as we continue to develop more this way, that, say maybe some months it's a little lean for what you might have, a topic for. So you could use one of these. And they're very basic education. You could use them for new CPAP users, obviously. This would probably be too basic for some audiences, but maybe not. Maybe they need a refresher. So what we're really anxious to hear is from people like Colleen and the other people that we have here today on suggestions of what you might need. Maybe you're already doing a group and maybe you need something. If you let us know, maybe we can help you. So let's keep that line of communication going there, and I'm going to turn it back to you guys.
Sure. And I think as well, you're right, Teresa. I mean, if I ever come to do a presentation, some slides are just pointers that generate discussion and generate topics as well. And I think, again, these don't have to be necessarily in order, but, some people want to hear, like Module 4, for example, talks more about masks and different types and which may suit, each patient. But again, I mean, when you look at Module 1, if you're prescribed a CPAP machine, like what's next? Because some people, want to talk about the diagnosis, what it means. I think down the line as well, there's other topics where people are curious about that sleep apnea is associated with more and more comorbidities. and people are quite concerned about that. So, we may work on something like that to sort of help people cope with different disorders like atrial fibrillation or hypertension or heart failure. But again, some of these are pretty basic, and again, it just generates some discussion. Teresa, I'm just going to ask you here, are there any questions out there from anybody in the audience?
No, and I'm so sad because I'm ready to go. Do you see me pulling the names up there? Can you see that?
No.
You can't see it, so only I can see it. Let's see, I think we have a hand raised from Joanne Elliott. Would you like to take her question now?
Sure.
Okay, let me see. Well, I'll have to look for it and let you know because now it's disappeared.
Oh, okay. Is it audio?
But she does have her hand raised. Oh, she has her hand raised.
Okay.
Silly me. We need to unmute her. So let me go to, it's not letting me unmute her. Is Sean still here? I don't think Sean's here. Well, would you mind terribly, Joanne, if you could type your question in because I am not seeing, wait a minute. All right, is that a HIPAA violation, she says. Okay, we email our patients. Is that a HIPAA violation? No. Go ahead, Colleen.
Well, we email our patients within our own A.W.A.K.E EMR. And when I get from A.W.A.K.E as a generic through my own email through work, I will usually ask them for their phone number and document that over the phone as opposed to an email, just because that's our policy. We don't do patient email that is outside of the scope of our own work unless it's in our own EMR. In Epic. So I ask for a phone number and I talk to them on the phone, and that's our policy, and that's the way I handle it.
Yeah. I always think sometimes, even in my profession as a transplant coordinator, you can get into a little bit of, sometimes email chains can go on, and then all of a sudden, like, people are asking you for advice that's outside your scope of practice. So I always sort of proceed with caution. At the hospital I work here in Toronto, we do have a consent form for patients to sign that if they do prefer to communicate by email, at least we've had their consent.
Okay.
Joanne and thank you so much for asking questions, Joanne. That just makes my day. Joanne says, we ask them for their email when they schedule, but we don't necessarily tell them we will put that email into a spreadsheet. So that is her comment.
Is the email used for their A.W.A.K.E type of thing, or is it just for questions?
I'm waiting for her to type it in. I think that there are forms that some labs use. They ask the permission to be emailed for a A.W.A.K.E group,
right,
or A.W.A.K.E group meetings, and that's fine. It's totally fine because they have opted in.
Right.
If they're really interested, they will say yes.
Yes. If their abilities allow them to do that, and they've already signed some type of consent to do that, then it's probably not an issue at all. And every organization is going to be different, obviously.
Absolutely, yes, and you have to work within, your confines. Okay, and Joanne says it's used to email them instructions, etc., and then after they have had a CPAP study, then they get put into a spreadsheet.
I guess there's maybe concerns there.
Not everyone goes on the email list, she says.
I don't know if there's just concerns there of sharing their email with maybe quote-unquote third parties. I mean, one of the things I wanted to put out there for groups that are happening all around the States is, if you do have a sign-up sheet to join ASAA, maybe sign up for their monthly newsletter at the meeting. it's, you know, it's a good way to stay connected. And again, you know, things out there like you touch on, Colleen, or the CPAP assistance program. There's webinar Wednesdays and Facebook Live events that I've spoken about. And I know you do talk about the annual Sleeptember campaign and the Sleep Health Mobility or Mobile App Study at iTunes. So there's a lot of resources out there, and it's, you know, beneficial for people to know that these things are there on a national level as well. So you can also follow us on Facebook, Twitter, Instagram, and LinkedIn, you know. So I think maybe that's where the concern is about people providing email addresses and then them being passed on. I'm not sure if that's what she means.
Well, Joanne says, so is that an issue? And again, I think that we have to look back at each hospital's policies, or each lab. If it's a freestanding, you know, there has to be someone that has, you know, the oversight that can give you that. I would caution anyone to do otherwise, because it could be something very big, you know, against the lab or what have you. So I guess first a person would have to learn what is, you know, what is the mindset of the company itself, the facility.
I mean, we've all signed up, I guess, on sites where it said we will not share your email with third-party vendors, or, you know, and that's probably something
that is legal for that's a very simple form. Now, whether a facility accepts that as okay, I'm cool with that, then, you know, that remains to be seen.
Yeah,
but
great question, a great point. You know,
it is very good. Thank you, Joanne. I know we probably didn't answer your question, but I think it'll lead you to where you have to go next. Maybe if you would like to contact me privately, I could maybe talk with you about it. My email is motherT, yes, you heard it right, motherT @sleepapnea.org. Okay. Well, there you go, guys. I'm turning it back to you. I don't want to take over your wonderful session here. I'm loving this.
Stealing our thunders. I'm kidding. Any other questions, Teresa? No?
No. Not that I'm seeing. No.
Great. Well, Colleen, I wanted to thank you for all your expertise. I think the points that you raised are absolutely wonderful and a great resource for people out there. You know, I think, again, when we're talking, you know, Teresa's put up the slide again of staying connected, which I've just spoke about. So, you know, we want to encourage more people to get involved in the communities. But I'm really happy that you gave up your time. You're obviously very busy with these programs, and you're doing it very, very successfully. And it's great to be able to share your expertise with people out there that are considering these. So again, if you want to email Teresa, she's putting up her email address. And if there are any other questions, we'll give it a couple of minutes, Teresa, just to see.
It doesn't look like we have any. Oh, let's see who we have here. Kara, I know Kara Spillman from somewhere. That name is very familiar to me. Eugenia, I don't know Eugenia Brooks at all. Laura Holly, that's familiar. Michael Hayes is familiar. And Samantha Otterstetter. I probably goofed that name up, but welcome. I'm so glad all of you came. Please contact us if you have any questions, if you have any concerns, you have any suggestions, maybe something, you know, a topic that might help you, something that might help you in your efforts as A.W.A.K.E coordinators.
I think, Teresa, I saw a question actually pop up, maybe from Holly. It's disappeared now, but it says I'm having trouble getting patients to the meeting. Excuse me, I need my glasses.
I don't see it.
It was.
Yeah.
Could we just speak to that, actually?
Sure.
People are having trouble getting people to participate. Any pearls of wisdom there? How do you entice them?
Well, I'm not sure. I think it has to start with your actual, from the very beginning. We have a pretty robust way of contacting patients through their whole treatment plan. So, you know, they come in for the sleep study, they get a packet of information. There's information in there about A.W.A.K.E. They come in for their follow-up for the results of their sleep study. There's information to contact a sleep educator. There's information on A.W.A.K.E. in there. And so they're getting it kind of here and there throughout. And then as soon as that prescription is generated, then right away they get that next mailing for the A.W.A.K.E. Our own DME also gives information on it as well. And so they're getting hit with it multiple times.
Yeah.
And not that they have to attend, obviously, every session or, you know, whatever, but it is getting out there. But being consistent with your meetings, that you can say, I have them, you know, on the third Tuesday of whatever. And so people will remember that in their mind's eye. And then also, or if you just like me, it's going to be in September, December, and I usually try to do it right around the Sleep Awareness Week through the National Sleep Foundation, and it's a good time to talk about sleep and launching anything sleep. So I do it around that time, and so it gives an opportunity of hearing that, and then you can kind of retain them by keeping them on a mailing list or emailing list. One of the things that I've heard two different things. I've heard from people that say, I love the email thing. I live and breathe on email. But in the group that I have, I can tell you that most of them either ignore the emails that have been sent, or they don't want email, or they don't even have email. I mean, that's not real. Obviously, your elderly population, they probably are the ones that don't have it. But sometimes it gets overlooked, and sometimes things in the mail these days do get looked at. And it is a little more expensive, but I think it's maybe a more accessible way, and maybe that's been the way I've been able to maintain a lot of these patients that have been coming for 20 plus years that I know by name. I mean, I was walking in Nisswa, Minnesota, 3 hours away, and I heard on the street and window shopping, Colleen Buzina. That's not obviously phonetically it's Bazzani, but I knew that they were Colleen, and I turned around and I'm like, I don't see anybody that I know. Well, come to find out, this guy comes up to me and said, you set me up on CPAP, and I know you, and you do the A.W.A.K.E. meetings. And my heart melted.
Yeah, that's awesome.
And he says, put me back on the list. I'm up here at my cabin all the time, but I'm in the cities, you know, in September to see my family before the snow flies. So it was such a great honor to have that happen, that he remembered for so long that was an important part of his adherence onto CPAP, and that all the A.W.A.K.E. groups did help him a lot.
Right.
Well, you know what? I mean, that's you really, when you look at the model that you have used all these years, and I remember you from all those years, I always think, you know, this is a different model. This is a robust model. This is, you know, excellent. And then when you look at our, you know, in the face of the new work that sleep technologists are looking to do in their field, the Navigator. You've been doing Navigator since 20 years ago, really. I mean, because you have that continuum of care. You are reducing them coming back to the sleep lab because they're doing well, they're adherent, they're happy, and obviously the ones that keep coming back feel some kind of homage to it. I mean, they want to, you know, they want to deliver the good message. Look at me, I'm a CPAP user, I'm healthy, or, you know, whatever. I mean, the whole thing is just marvelous. And hats off to any of you that are doing this, or if you would like to do it. I can talk to you all day long about it, but, you know, I can certainly get you in touch with Colleen, but we don't want to overpower her. But we're just so grateful to you, Colleen, for being here today.
No worries, but you know, I do want to mention one thing, and it's kind of a negative thing, but as a host for the A.W.A.K.E. for all these years, you really do have to have some thick skin. Because, you know, I have done some presentations that have been so, in my opinion, great content, great education, great Q&A afterwards, great everything. And then you have that person come up to you and say, well, I'm sorry, but this was not helpful. And then you just kind of deflate. And they really have to kind of, you know, suck it in and say, well, what can I make it be better? Or how can I help you? Why, here's my card. Give me a call. We'll chat on the phone. Those type of things, because there are going to be some negative Nancy's and negative Neds out there that are going to be never happy. Whether it can be the food, the vendors, the elevator ride up. I mean, I can tell you, I have had such awful people come up and make some comments, and I don't want that to deter people from not to continue, because if I would have quit based on a couple people coming up to me, you know, I would say at one meeting, every meeting I have one person that comes up, and it could be as simple as, you know, there was a rip on the carpeting and I almost fell, to the food tasted terrible to the presenter. I mean, it could be just one thing, but I would have quit a long time ago. And just realize that 99% of the people are going to enjoy the topic and everything that is going on, because, and I will bring this up to my group, we are all volunteers here. We are not getting paid to do this. Unless your organization is paying you for your straight time, which into the evening I will get paid straight time. But all the other stuff that goes around it, I do not. This is on my free will. And I think that needs to be given out to the group as well, that this is a volunteer organization. And you can always say, I'm looking for patient volunteers to help us out, because in order to keep this going, you do need to kind of have some extra helpers here and there, whether it's refilling the punch or directing people to some paperwork that might be at a different area to pick up. Sure. So I just want to encourage people to get their skin thick and go with it. I had this one, just a quick story. I had a presentation, or a presenter that backed out on me in the last moment. And I had a talk a long time ago that I was going to present to a school and never did, and it was on sleeping animals. Well, I ended up pulling that talk out and just doing it, and I did a Q&A on sleep and sleep apnea prior. So there are lots of questions about sleep apnea. We fielded everything. And then I just did this 25 minute presentation, because I said my speaker is canceled out. If you want to stay, stay. If you don't, go. And it was all from reptilian all the way up to mammals to dolphins and all how the whole animal kingdom sleeps very differently, but very the same in many ways. And so anyway, I had this woman call me like 3 weeks later and said, that was the most unhelpful presentation I've ever had. And she just ripped me a new one. And I thought, you know what, lady, I think you're probably just crabby about life anyway. And maybe you're not on therapy. And that was my thought in my brain, because you know what, she just wasn't happy about anything. And if she would have been forthright and came up to me maybe at the presentation, and maybe she walked in late and didn't know that the presenter did not show up. I mean, there's a lot of reasons why people have negative comments, but it's all in all, it's all good, and just keep your chin up and keep going. And the benefits obviously outweigh the negatives that are out there.
Yeah, you know, I'm really glad you said this, Colleen, because I think that's great advice for people, because you know, you put your heart and soul into something, and, you know, that one person that makes a comment, even though 99 people said you were great, it's that one person that sticks with you, and you think, wow, what did I do wrong? And, you know, we're all inclined to go with the negative, and we shouldn't. We should focus on the positive. But I think it's great advice, because even classes we run at the hospital, and incidentally, I thought of this, there's, you know, for post-transplant kidney patients, we like to run quarterly groups, and we advertise it as connect and learn. So you're connecting with people similar to you and also learning.
Sure.
And again, the big feedback that we get, because we do have formal evaluations, is, you know, the patient panel. So most people really enjoy hearing stories and struggles and successes from people like them, you know. But on that note, do you actually have a formal evaluation sheet that people fill out, or it's just the comments that you share that you're speaking of?
I have 3 or 4 times in the last 30 years did a questionnaire about topics or formats that they would like to hear. And that's basically all I have done. You know, the question about email versus mailing. And I followed a lot of the advice as far as, you know, a lot of the topics they wanted to hear was about weight loss and surgery. That was back in a lot of the UPPP days. But I've only done it 3 or 4 times, and I think it's helpful. I do. And I think maybe doing that every number of years is a good thing. Because, you know, obviously your population is going to change. I can tell you that the population that I see coming in, the new people that are coming in, they're way younger. And they're very tech savvy. And they like all the, you know, the different apps that you can get on your phone, whether it be for any type of PAP machine or their own sleep app that they have. So, you know, they want to talk about that type of stuff. And I think that's a good thing to do every couple of years, people that have been doing Awake for a while to check it out.
Yeah. And I think maybe my advice if people were starting up a group as well, it's important maybe to have a formal evaluation so that it can help mold future groups and find out in your area what people are really wanting. You know?
Yes, that's a great idea.
Oh, somebody in our evaluation one time at the hospital complained that we didn't have Diet Pepsi, we only had Diet Coke. So, you know, you do get them.
Hey, you know what? There's one in every group. I have spoken at more Awake meetings than I can even count, and they're, you know, across the country. There's usually one person, you know.
Don't let it get down. Okay, well, I think that's time to wrap up, Teresa, unless you have any other comments or questions or.
No, I just think this was just wonderful, and I'm so excited to help anybody out there get going with if they're not an Awake member, an Awake coordinator, excuse me, and they want to be one. You know, I can help you with that, and just to have you in the fold is so important. If we're all talking to the patients, you know, as many of us as possible, it's just a good thing, because, you know, what's really sad to me sometimes when I get, you know, calls or emails from the patients is, you know, that I don't have an Awake group, you know, or do you have an Awake group in my area? And they don't even have one in their state, because used to be the Awake groups were more popular, or not popular, but I think with time, with medicine and all the challenges that we've faced as facilities and et cetera, you know, some things just had to go by the wayside, and we are here to help people revitalize that if they would like to, because I certainly would like to see one in every state at least.
Yeah.
We used to have so many. There were some, weren't there, Colleen? There were just,
yes.
I mean, I was speaking at them, so I know.
Yes, they were all over.
I was living in the airport and sleeping in the airport.
Yeah.
Great.
Well, if we, I'm gonna let Kevin close here, and I'm just thank you again, Colleen, and thank you everybody else that attended.
Thank you.
Yeah. Great. Again, Colleen, we really appreciate your expertise and your open, honest way of, you know, how you get through these. And I know I hope, you know, it's a lot of work, and I hope you've encouraged people out there to start a group, you know, and certainly use the resources that you have available to you as well online. Okay.
All right.
All right. Well, thank you so much. And everybody have a great day.
You too.
Thanks.
Thank you.